Hi, this is Dr. Yearsley. I'm a licensed social worker and licensed addiction counselor, and I'm going to be talking about a really tough topic today, and that is, why won't my loved one stop using substances? This is a tough one. You know, a lot of folks come into therapy, especially family therapy, and they're concerned about their loved one who has an addiction to maybe one substance, maybe many different substances, which is what we call polysubuse. It's hard to know as a family member what to do to help your loved one that's in active addiction. When I talk about active addiction, what I'm talking about is substance use disorder. And this is a DSM-5 diagnosis. What does DSM-5 mean? DSM-5 is the mental health manual. It's a Bible, if you will, of how we diagnose mental health disorders. It's called the Diagnostic and Statistical Manual, Edition 5. So now that you know where we go when clinicians like myself diagnose our patients, that's where we go. And in that diagnosis, substance use disorder, there's different criteria that a person meets when they come in and they have an intake done. So when families come in, they are panicked. Some of them are traumatized. Some of them are just absolutely beside themselves in terms of what they can do to help their loved one. Totally makes sense. It's totally normal as a family member or a friend or a significant other to feel that way when we're watching somebody that we love with an active addiction. An active addiction can also be called a substance use disorder. And there are several different types of substance disorders within the DSM-5, or the Diagnostic Statistical Manual Edition 5. This is the manual that we use to diagnose mental health disorders. And by the way, addiction disorders, they're in the DSM-5, a mental health diagnosis manual. I think that's important for you to understand. So a lot of times in the mental health world, we try to separate as clinicians. There's, active addiction disorders, there's behavior addiction disorders, and then there's all the mental health disorders. And really what's happening is they're both together. They're one and the same, in my view. Now, why are they one and the same? Well, partially because they're in the same mental health diagnosis manual. But the other side of this is we're looking at biological components, psychological components, social components, spiritual components when we are trying to put together and assess whether there is a diagnosis there for that patient. So we're looking at similar criteria and similar areas within a patient profile. Which means if you're coming in and you're working with a clinician, they're going to be assessing or doing an intake, just like if you were going in with a primary care physician and you had a pain in your leg and they were assessing that too. Trying to figure out, where is the pain coming from? What is the proper diagnosis? What have we ruled out? And how does that fit in terms of a good treatment plan to help you feel better? It would be like if you were going into your primary care physician to be assessed and talk with he or she about whether you had diabetes. There is a diagnosing protocol for that, and that is true for mental health disorders as well. So back to substance use disorder. What do I do and what can I do if I'm a family member with a loved one who I cherish who is using substances? You know, first of all, I want you to understand that it's normal to feel panicked about it. It's normal to feel worried. It's normal to feel sometimes helpless about what to do. And there are family members that come in and feel hopeless about what to do. I want you to know that there's always hope. Always hope. So please, if you hear anything with this video today, it's that there is hope for you and for your loved one. Never give up on that, even though it may feel at the time like there isn't. So what can I do? Let me share 4 ideas with you about what you can do. And, these might be things that you've heard before, but I really wanted to outline from a position of empowerment what the family member can do. And some of these things I could probably make an individual video on, right? And I can go into more detail about it. But these are just general ideas for you to think about and consider. Number 1, I want you to understand that you cannot fix the problem. There's no amount of begging, pleading, shaming, yelling, crying, ultimatums, the list goes on. There's no amount of manipulation that's going to work when we're dealing with a loved one who really, truly has an active addiction. You know, substance use disorder is like a spectrum. If you could envision a piece of yarn, so you've got this piece of yarn, and you've got the beginning of this piece of yarn, and then you've got all of the width, all the way to the end stages, right? It's really a spectrum disorder, in my opinion, meaning it's staged. You know, the first time that you take a sip of alcohol, you do not have substance use disorder. This is something that happens gradually over time. It's something that builds over time. And it builds not just within the psychological component or the social component of what we're dealing with. It gradually over time also impacts your whole body. Every cell in your body is impacted by substance use disorder. So every organ, everything. So when you think about it in terms of it's a holistic diagnosis, meaning it's impacting both your brain, your body, and your psychological health, then it gives a little bit broader picture, I think, of why it's really difficult for your loved one to stop using. This is a big problem. It's a big diagnosis, and it didn't happen overnight. It's something that happens gradually over time. With different people, it can take longer to build up tolerance and dependence and all of those things than with other people. Every person is different. It's not a one-size-fits-all in terms of treatment or diagnosis necessarily. There are factors that kind of come in and interplay within that diagnosis. So keep that in mind, that it is a bigger context than just stop using and you're going to be fine. Let me also explain that family members sometimes go through the let me grasp at straws so that I can figure out what I need to do to help this person to quit. And at the end of the day, what you have to realize as a family member or a significant other, a friend, is that it has to be their decision. It really does have to be their decision. They have to decide when they are ready that they are going to get help. And it's only at that point, with professional help, when they have self-determined that it usually works. The average number of visits to a treatment center before prolonged abstinence right now is 7 times. The average person or patient goes through 7 episodes of treatment before they usually get to the point of prolonged or longer term abstinence. So the gradual nature of substance use disorder building over time in its intensity, its duration, and its severity. And then the ability for that patient to work that treatment plan and stay in this place of abstinence, meaning they're no longer using any substances and they are clean and sober. That can be a process as well. So it didn't happen overnight, and it's not going to be fixed overnight. And the other side of that is you can't fix that problem. So what can you do? You can set some personal boundaries for yourself. You know, when all of this started, if you think back, you probably didn't have the same things that you're dealing with now that you did then. I would imagine that if you really sat and thought about it, things have kind of gotten worse over time. And so there's probably a need for you and your family members to come together and as a group with professional help, decide what boundaries you're going to put in place with your family. In addition, get your own help and support. It is really, really important that you have a way to process through what's happening for you too. Family members that are living in a situation with a loved one in active addiction also can experience trauma, grief, fear, anxiety, depression, and a myriad of other mental health and emotional symptomology. It's true. And the reason why is because we love and care about this person, involved in this cycle of addiction. Very often in the addiction community, we call that the family cycle of addiction. And it's true. Because when you love someone and they're dealing with a chronic medical diagnosis, you are there to love and support and encourage. And by proxy of that, you also experience some of the highs and the lows of that particular case. So as a family member, I want you to know that's normal. No, you're not crazy. You are dealing and living in a crazy situation. But because of that craziness, because it's unpredictable, because in some circumstances it can be dangerous, I want you to seek your own professional help, support groups, everyone in the family, so that you can come together as a family and decide how you're going to hold boundaries. Number 2, your loved one using does not, I repeat, does not, let me put that down here, does not mean that they don't care about you. I have a lot of people that come in and they're like, well, if they just loved me, then they would stop using. That is something that I hear a lot, but it's actually not true. I do believe your loved one in active addiction does care for you. It's just they are struggling with a disease that affects their brain and their body and their mental health, that they cannot snap their fingers and be well and have it conquered. This is something that they're going to need professional help to overcome. And with that being said, the components of how a substance impacts the brain, and I'll do a video on this so that you can better understand that. The way that a substance impacts the brain really kind of hijacks that frontal lobe and the amygdala center of our brain. In active addiction, the priority for the person who is using substances is no longer family, work, friends, social norms, mowing the yard, doing household chores, being responsible, all of those things. That is completely off the table now. What is most important for a person in active addiction is using that substance. And this is part of the brain function that's going on right now. It impacts active addiction, the frontal lobe of the brain, and also more specifically, the limbic system of the brain. And there are other areas that are impacted as well, but for the sake of this video, those are the two main areas that we generally talk about in terms of education. So the limbic system of the brain is the fight, flight, freeze, or fawn system of the brain. It's kind of our most base survival mechanism of the brain. And when it is impacted with drugs, or any kind of substance really, it is always on high alert. We're dealing with a brain disease that, for the lack of a better word, has hijacked their frontal lobe, which is where we process emotions, we make decisions about things, we view and weigh the moral consequences of the decisions that we're making. All of these really important emotional decisions are made in the frontal lobe of our brain, in addition to some other things. But for general purposes, we've got a frontal lobe hijacking going on. So what you see in terms of your loved one making decisions and not understanding why they're making those decisions, why don't they love me? If they love me, they'd just stop. They're not able to do that because the substance is now hijacked that part of their brain, which means it's essentially offline. It's not working. The dominant part of their brain that's working at this point is the limbic system of the brain, the amygdala. And what happens there, it's our pleasure center of the brain. And when we introduce substances into the amygdala center of our brain, the limbic system, it's also our survival mechanism for our brain. It's impulsive. Its job is to make sure that we survive in any situation. So when we introduce substances to that part of our brain, it is an unnatural high because it's done through a chemical, an outside chemical, which is actually a poison or a toxin to our body. But your brain can't decipher. It can't figure out whether this is something that was created by the brain, a neurotransmitter, because we have neurotransmitters that produce pleasure naturally in the brain. And then is this a chemical that's actually being introduced to the brain that then produces an unnatural high? And which one do you think the brain's going to want to seek after? Well, the unnatural high is always going to be stronger and more pleasurable than the natural high. And so therein is why people are drug seeking, because they're looking for that unnatural high. They're looking for that chemical high. It's hard to hear, I know, but it is true. That is drug-seeking behavior when we're talking about the brain disease of substance use disorder. In addition to that, you're going to see that they are going to use regardless of the consequences. And sometimes as a family member, that's how we can get to this point of, well, they don't love me. They do love you, but that's something that's buried way back in the back part of their brain. Remember, their brain is being influenced by chemicals, and those chemicals produce an unnatural high that is very desirable and pleasurable in the limbic system of their brain. And that drug-seeking behavior becomes the most important thing, even more important than family, friends, commitments, work, social situations, anything. It takes over. And so in that circumstance, it feels like they don't love you. But I want to tell you that they do. I have seen many, many patients, hundreds of patients over the years, who as they are in treatment, as they become sober and clean, and as they are working through abstinence, they understand that there have been some difficulties that they have caused with their family. And that really wasn't initially their intention. It's heartbreaking to see patients in recovery that are now having to rebuild their lives. And the reason why I want you to understand and why I'm sharing this is because they really do care about you. It's just that with the disease of addiction, substance use disorder, formally diagnosed, in that moment of active addiction, that is not the brain or the body's priority. The priority is using that substance. So number 3. Now, this one may seem counterintuitive, especially if you're a family member and right now you're feeling really angry about the situation that you're having to deal with. I get that, okay? But in terms of what can you do, use professional help to step back and to get to a place where you can continue in a detached fashion, right? Because we don't want to be pulled into an active addiction situation. You really don't, because that can involve sometimes even violent situations. What I want you to do is get to a place with professional help where you can kindly offer love and support and encouragement for the individual. And then somehow get to a point where you can separate the substance use disorder from the person that you love and care about. They really are two different things. Even though they're housed in one body right now, they are two different things. Being at a place where you're a family member, we don't get to force people into treatment. It's never going to work, folks. People have to self-determine. They have to be willing to choose for themselves their destiny. And it's kind of a double-edged sword here, because if a person is in active addiction, they're not making the most regulated and, frankly, level-headed decisions at the time. I get that. But there are moments of clarity, even in active addiction for a lot of patients, where they get to a point where they're like, you know what, I'm tired of being tired. I'm sick and tired of being tired, and I want to be done with this. And so what we've got to do as family members is go through our own treatment, be able to detach ourselves enough that we're not being sucked into that vortex of their active addiction problem, and have services or ideas of professional help ready for them if and when they're ready to take that option. Now, the fourth thing I want to bring up is there's a lot of stigma out there related to active addiction. You know, this comes from hundreds of years, literally, of looking at the junkie on the street or having this mentality of they're not worth it or they're too sick to be bothered with, or, you know, they're bad people, they're morally horrible people. You know, there's all of these stereotypes that go along with the image when people use the word addict. So the fourth one is kind of a hot topic. And I'm going to throw this out here after many, many years of working in the addiction treatment industry. One of the myths, I'm going to call it a spectacular myth, okay? A Smith. Dr. Wise Smith number 1 in this video is that a person has to hit rock bottom before they'll get treatment. Not true. First of all, there's no one size fits all in terms of recovery. No one size fits all. Every patient that has come in and sat in my chair to try and get help for overcoming a substance use disorder or some other behavioral addiction is different. They're unique. Yes, there are trends and patterns and similarities, but there are also enough differences that we've got to look at treatment as an individualized process, okay? So along with that line of thinking, there isn't necessarily a rock bottom. Ultimately, rock bottom, when we're talking about active addiction, is the death of our loved one. Folks, that is rock bottom, and that is what we are trying to avoid as a family member. So what I want you to do, if you can, is try to block out all of these myths, these spectacular myths that really aren't true, because they rob us of the hope that our loved one can just one day decide, you know what, I'm tired of being tired. And by the way, it does happen. I want to give you hope in this area. It does happen. So treatment is not one size fits all, which means that we've got to be open to different styles and forms of treatment for what's best for that individual. Okay, so that's good. When it comes to rock bottom, people at different stages of their active addiction can make that choice that they really are tired of how things are going and they would like to shift gears. Okay, so rock bottom is whenever a person decides that they're ready to seek treatment. That's rock bottom. Every person's rock bottom is different. And in my view, I want to avoid the ultimate rock bottom in this situation, which I've already mentioned, is losing the life of the person that we love. Don't lose hope. When people say rock bottom, what I really think they mean is treatment readiness. And everybody has a different level or a different timing or a different desire for treatment, when and where. And you never know when that's going to be. So I don't want you to lose hope as a family member. And remember that your hope is and can be contagious in this situation. So in this crazy cycle of addiction that you're being pulled into because of your loved one's use, if you can, I want you to take all of that focus and all of that energy of saving and possibly enabling, and I want you to focus on yourself, your own healing, your own comfort, your own safety, and your own mental health. A lot of family members develop their own mental health problems as well as biological or medical health conditions because of their loved one's use. I want you to hear two words, okay? And it's a process to work towards these two words. It's a mindset of family members, but I want you to see if you can work through this and work to this. And that is, consider radically accepting that you cannot save your loved one. I know that's hard. Yeah. It's got me right now doing this video. But as much as we would like to, we can't save them. Ultimately, when people are in active addiction or any kind of situation that is dangerous or it's life-threatening, they have to make that decision that they themselves are going to step up and do something about it. But ultimately, you are not without power. Look, you not being healthy and being at your best does no one any good. It doesn't. So I want you to take that back, that power, that energy, that worry, that anxiety, and start focusing on your own mental health, your own physical health, and radically accept that your loved one has the ability, the right even, to make their own decisions. Now, when you get to a point of being able to accept that, hopefully that will free you of feeling like I have to go in and rescue. And maybe I should do a video on rescuing because that's a whole different topic. But I want you to understand that it is possible to get to that point as a family member. And it doesn't mean that you don't love your loved one. It doesn't mean that you've given up. And it doesn't mean that you can't be there for them when the time is right. What it does mean is that you do not have to go down with the ship. Don't forget to like and subscribe to my channel. And if these particular videos on addiction medicine are helpful to you, let me know in the comments down below.